We are recording. This is so exciting. I have a special guest, and she's actually in my home studio.
Yes.
So I'm so excited to introduce to you all Dr. Kesa Troutman, specializes in weight loss and menopause. So I asked her if she would be a guest on this Polished Professional. So we do this every Thursday at noon, where I blend beauty and business, and menopause is a big, huge topic. A lot of us are going through it, and there's so many things that you need to know about it. And I was just telling Dr. Troutman, I've never felt better than I feel right now. And it's all because of you. So I want everybody to know about, you don't have to feel bad during menopause. And so I think there are so many myths out there, would you say, myths
Absolutely.
about menopause? Yeah. So first of all, tell us a little bit about yourself, and then let's go through some of these myths of menopause.
Excellent. Well, thank you so much for having me. I am so excited to be the first in-house guest. Yay.
We have to do this more often.
Yes. So again, I'm Dr. Kesa Troutman. I'm a quadruple board certified physician. I'm board certified in obesity medicine, culinary medicine, family medicine, and menopause society. I talk about the struggle with weight and perimenopause and menopause, not just from a professional perspective, but also from a personal perspective, as I am also a person that has struggled with weight my entire life, and currently in perimenopause and struggling with it and getting treated for it as well. So, so perimenopause and menopause. I think maybe let's start with definitions.
Yes.
Right.
When you told me about perimenopause, how it was just menopause with period.
Yes.
Yes.
Yes. You remember that,
Yes,
right? So first of all, what is menopause? So menopause is technically a term we use if a woman has not had their period for 12 months, which is such a backward diagnosis, right? How is that going to help me now?
Right.
And the problem with that diagnosis is symptoms of affecting our whole life, our brain, our heart, our body, start almost 10 years before that happens.
Wow.
Yeah. And perimenopause is technically the transition years. So it's the number of years before you actually hit menopause.
Okay.
Yeah. And again, it's so, I guess one of the myths, let's just jump into it. One of the myths I hear is that I can only be treated when I'm in menopause. Have you heard that?
I thought that.
Mm-hmm.
I had no idea. Yeah, I had to wait. I felt like I waited until I was miserable to get treated. Yeah.
Yeah. And here's the thing. So hormone therapy. So I am a physician. I really emphasize using FDA approved options. FDA approved options are the ones that you get at your pharmacy, whatever pharmacy you are. And that's because we know that these options are checked for purity, and you know that, let's say it's 100 milligrams, you are actually getting 100 milligrams. And these are the meds that have been tested in the studies as well. So anyway, though these are FDA approved for only 4 conditions, but we can use medications off label, right?
Correct.
Just like I don't know about you, but birth control historically has been used for acne.
Right.
Birth control has been used for regulating periods, right? So, that's so common, right? We don't even bat an eyelash when somebody gets birth control for acne.
Yeah, that is so true.
And that's technically off label.
Yeah, so true.
Right?
I like how you explained that.
But if it's for hormone therapy, oh my God, you're getting hormone therapy? No, it's okay.
Right.
And I think it goes back to, the problem we have where, it's not taught in medical schools. It's not taught to physicians and other practitioners. So they're coming in with no knowledge of really how to approach women in midlife.
Yeah. And I can just say that, like, when I went to my regular doctor, that was the first thing is, do you know the side effects? It's almost like she made me feel guilty for
asking.
Yes. Mm-hmm. Yeah. So, yeah.
And I think here's how I look at it. And I'm going to be the first one to raise my hand that when I didn't know any better, that was the same thing I would tell patients that asked me. And it only took me going through my own personal journey to really what the F?
Right.
And this is not normal. And I think I need to fix myself. And that's kind of what I did. So I got bored. I deep dove into the information, got board certified by the Menopause Society, and really just understood the science,
Yeah.
And
it's like you don't know what you don't know.
Yeah. And now that I know more about about the midlife transition, I'm like, oh my God, what, like such a disservice it is when you don't know. But anyway, yeah, so they're operating under an old manual. You know what I
Yes.
mean? Like
Yeah.
there is a new manual, but nobody's reading the manual. So they just
Yeah. So you were a godsend.
Oh, I appreciate that. It's just so funny how we met, right?
I know,
Yeah.
right? It was all
Like
networking, and it was
yeah.
just it was meant to be.
Yes,
It was meant to be.
it was.
Meant
Just
to
like I'm meant to be here.
Yeah. I know. This
in
is
your,
so,
in
this
your
is so
living
fun.
room.
This might have to be like the new thing.
There
you
you
gotta
go.
come to my house.
Yeah.
Yes. So what other myths are there?
Oh my God, so many. All right. So first would be age, right? So the first I think is menopause doesn't hit until you're 50, which is, again, we go back to the symptoms, right? Symptoms of hormonal changes, so estrogen and progesterone changing happens at least 10 years before. So average age of menopause is 52.
Okay.
Average age of perimenopause is 47, but the symptoms can start as early as 35.
Wow.
That's natural.
Yeah.
That's natural, perimenopause and menopause. And there's like, I believe 7% of women in the US will have what we call early menopause, which is instead of starting at 52, they get their menopause at 40.
Oh, geez.
So, I mean, so
30.
there's even,
Yeah.
you could even have symptoms as early as 30.
Gosh, I wish I would have known this when I was in my late 30s and 40s. Yeah.
And honestly, when I first started, my own story was I struggled with insomnia. Like in my early 40s, I would like have no trouble falling asleep, but I would wake up at 2 or 3 a.m. wide awake, and I couldn't go back to sleep for many, many years. And I, as a working professional, it's like I always had found a reason to excuse it.
Right.
I think we're very good at that, women.
Oh,
I was just I was stressed, so I didn't sleep. Oh, I have a lot on my plate, so I didn't sleep. Oh, XYZ,
Right.
I didn't.
It's
Whatever.
almost become normal. It's normal to feel that way. It was normal for me not to feel good. Yeah.
Yeah. And I think society kind of fuels that message a little bit more.
I
Like
completely agree.
you should just deal with it.
Yeah.
You should just, it's expected. It's normal.
It's normal. Right. It's not normal.
Yeah. Yeah. Well, right. The transition is an expected normal stage, but the suffering is optional.
Like that.
It
The
is.
suffering is optional.
You
You
do
hear
not
that, ladies out there?
Don't have to suffer.
Yeah.
And when I'm sharing my story, I always kind of think about it because I literally have 15 symptoms of perimenopause. Did I tell that? Did I share that? I have. So first, again, it starts with like, okay, sleep. Oh yeah, I have anxiety. I have dry eyes. I have palpitations. I have occasional dizziness. I have tinnitus. I have, like, obviously it doesn't all happen at one time, but throughout the years, I was like, oh my God, I probably was in perimenopause at like 38.
Yeah. I didn't know it.
Yeah, but because I had kids and I had a job, it's like,
Right.
of course.
Yeah. It's not that, it's this. That's
Yes.
Yeah.
So again, it's like it can happen as early as 35, the symptoms, right? Now, certainly you may not have the period irregularity, which is how, again, we talk about the backwards diagnosis of just using one body part, which is your period,
Right.
one body function to determine if you're in menopause or not. When you could have brain fog, anxiety, insomnia, heart palpitations, so many symptoms.
When you said that perimenopause is menopause with a period, that made total sense to me.
Yeah.
Any other myths that
my God.
there's probably a zillion.
But. Yes. I think the most common, safety is a big question, right? So I think the most common myth I hear from other people is like, estrogen is bad. Estrogen will give you breast cancer. Estrogen will give you heart disease. And this all stemmed from a study back in 2002 called the Women's Health Initiative, which, by the way, that's a majority of the authors of that study has already retracted their statements. And really,
but you don't hear that. You only hear that the study said this.
Yes. They retracted their statements, and really now the data has shown that, number one, it does not cause heart disease. It actually is protective. There's a long-term study now from the same Women's Health Initiative study that showed that women on hormone therapy actually live longer. It actually decreases heart risk, cardiovascular, and it's actually protective of breast cancer.
Wow.
Yeah.
Sort of the opposite of what they were saying.
Yes. Now, let me rephrase that a little bit by especially those statements that I just made are targeted for women that start hormone therapy within 10 years of menopause. So there's something called the 10-year theory. Have you ever heard of that?
Only because I heard you talk a
Oh,
little
okay.
bit
Yeah.
about that, but
Yeah.
I had before that, I'd never heard of that at all. Yeah.
So the idea is when we lose estrogen, our cells do not like losing estrogen.
Mhm.
So we get, cholesterol goes up, all that stuff. But if we get it started early, when it hasn't missed, when estrogen is still in the house, right?
Yeah.
Not out the door. If we give our body estrogen now, there is just that, less likelihood of all the badness that happens. Yeah.
So interesting.
Mhm.
So interesting.
So that's why we want it started early, then like 20 years later.
Right.
Yeah. And
With
again,
all that time of the symptoms that you're
Oh my
just
God.
dealing with. Yeah.
yeah, it is quality of life.
Yeah.
Right. We want quality of life. There's this whole generation, of women that didn't get that were made to suffer hot flashes, anxiety, brain fog. And if you we talk about it a lot in the medical community, all of us hormone specialists, we kind of have our own chat
Mhm.
groups and stuff. And we talk about, the diagnosis. And let me rephrase, let me start by saying fibromyalgia is real, irritable bowel syndrome is real.
Sure.
There's definitely physiologic reason for that.
Mhm.
But what if it actually was perimenopause mixing up?
Right.
You know what I mean?
Right.
Or even like just anxiety and depression. Like I remember seeing somebody post like the time that Women's Health Initiative happened and estrogen use went down. That's actually when antidepressant prescriptions went up.
Wow.
Like
That's
in
interesting.
data, like they actually saw that because of course we're not allowed estrogen. So you have all these anxious, depressed midlife women struggling with a biological reason
Mhm.
for their problem, the
Yeah.
anxiety and depression, and they would get antidepressants. And
That's-
again, I'm not saying antidepressants are bad. There's
No.
definitely a legit reason for that.
Right.
Right.
But what if?
Yeah.
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 So
What
interesting.
if?
So interesting. Like,
Because
so interesting.
estrogen is everywhere.
Yeah.
And my goal or my wish, hopefully in the future, is that when physicians are dealing with midlife women, right? Instead of like, oh, I'm having heart palpitations. Okay, you go see the cardiologist. Oh, I'm feeling sad and depressed. Okay, here's some antidepressants, see a counselor. And again, I'm not saying those are bad things. Or if I'm having migraines, okay, see a neurologist. What if we put on this lens of, is this hormonal?
Right.
And look at it all together.
Yeah.
Because
Yeah.
they can all be affected by
Yeah.
estrogen.
Someone once said to me that I thought was really interesting. So like physicians, when I look at you, I don't want to just look at one thing. It's like opening the hood of a car. If there's a problem here, then is it coming from somewhere else?
Mhm.
So that's so interesting that you say that. Yeah.
And again, unfortunately, we're in a broken health system, right? Where people have 5 minutes. I don't know how many minutes yours has, but right. So you really have to advocate for yourself. You have to advocate for yourself. You have to come prepared with your lists. And then, and I think if ever anything comes out of our chat, it's like women have to advocate for themselves.
And I was saying this to you earlier, sometimes you don't know what you don't know.
Mhm.
So you don't even know what to ask or ask them. So yeah, it's so important to advocate for yourself. And so I was telling you this before, I've told you this many times. I've never felt better than I feel right now. Not only the hormones, but the whole weight thing. I was having issues with the weight. After seeing Dr. Troutman, my life has changed dramatically.
Yeah.
And I just want you to know that there's someone out there that can help you. And she's in Camp Hill, but she came to York today. But if
Just for you.
Yeah. Now you set a precedent. Now everyone's going to have to come to my home studio. But if you want to talk to somebody about menopause, perimenopause, weight, she's your girl.
I appreciate that.
So how can someone get in touch with you if they want to talk to you?
Yeah. So first of all, I have a Facebook page called Weight Remedy, and I usually drop like nuggets of wisdom about weight and perimenopause, menopause, hormone therapy. So follow me on a Facebook as well. But if someone is interested in becoming my patient, I am online. So go on my website, and we can attach it.
I'll put it in here.
Yep, weightremedy.com. And I offer meet and greets to anybody that's interested. The way I approach hormone therapy, for example, since we're talking about that, is I see you for 5 visits in 6 months, right? So this is not a here's your prescription, I'll see you in a year. This is a let's listen to your symptoms. Let's do one hormone at a time and kind of tweak that. And so it is a difference between a tailored, suit and something off the rack, because this is going to be long term. And so the reason I see people more often in the beginning is we want to hit, the percent that the regimen that works for you, and then you see me less often.
Right.
That's
And I'm different than the other person.
Absolutely.
Than the other person. So it's so important. And I appreciate that. That's the other thing is I feel like you are my friend in the journey.
Yeah.
So you have a friend in the journey because it's difficult sometimes.
Yeah.
So I appreciate you. Thank you so much.
Thank you.
I will put the information below in the comments so that you can, go right to Dr. Troutman's website and even your Facebook page so that people can get information. Because some of the things you post, they're like, whew, mic drop.
Yes.
Yeah.
Yes.
Yeah.
Yeah.
So amazing. Thank you so much.
I appreciate the opportunity.
This was so much fun. I hope you learned a lot. And again, if you have any questions, comment below and we'll answer them.
Okay.
Have a great day.
Yay.
See ya.